Hello there, Sierra Nevadans. Dr. Evans here. Quick update this week about COVID-19 and everyone's favorite topic right now is the vaccinations. And the big question that we're all getting is where and when can we all get our vaccinations done? So it's been, shall we say, a little bit complicated in terms of the distribution of vaccines nationally, not just in Nevada County, but all over the entire country. So I just want to kind of clarify it as much as I possibly can. There are four main sources of vaccines going into communities, including this one. The biggest by far allocation of vaccines is going to the county, and the county is distributing vaccines to various partners all over Western Nevada County, places like physicians' offices, the federally qualified health centers like Western Sierra, and other places, and they continue to ramp that up, and that's how they're scheduling patients to get their vaccines. Sierra Nevada Memorial Hospital is also part of what we're calling a multi-county entity, and we have received vaccines that are really indicated for healthcare providers and physicians and those sorts of folks. And now we're shifting into 65 and older patients who are part of the Dignity Health Medical Foundation. So those are people that see their doctors over at the Foundation Medical Office. What we'll see next, I think, is we'll see some of the commercial pharmacies start to distribute vaccines as well, places like CVS and Walgreens, etc. As far as I know, that has not happened yet. That is part of the plan. And then the fourth mechanism by which vaccines are coming into the community is through the Indian Health Service. Chapaday is getting vaccines, and they have been vaccinating patients as well. So nobody is getting as many vaccines as they want to get. It continues to ramp up, but we're hoping that the vaccine distribution really increases significantly so we can really start to vaccinate a lot more people in Western Nevada County, and then we can open things up as quickly as possible. I do want to just give you an update on how we're doing with COVID. We continue to do well. We had a peak of admitted patients of around 15 patients here in the hospital, but that was quite a while ago, and now it's kind of tapered off a little bit. So we're doing quite well. Staffing has been tight in general with other things, and since a lot of other hospitals are much busier than ours with COVID, we have had a hard time getting more nurses into our community because they have to go to other places. So that's been a challenge. We're continuing to partner with the county on vaccine distribution. We are going to be setting up a county-run clinic on one of our properties at Whispering Pines, but that is not open yet, and we will certainly inform folks when that is coming online, and that'll be a county-run clinic. If you are curious about when you can get your vaccine and you want continuous updated information, the best way to do that is by texting 898-211 vaccine info, all one word. Just text vaccine info to 898-211, and then you'll be able to get continuous updates about where you stand with your particular tier and when you can get a vaccination for COVID-19. That was a lot of information. I hope it made sense. It's been interesting, and it's been changing pretty rapidly, and I'll continue to update you guys once a week via these video messages. Thank you very much.